Many suffering from addiction feel ashamed rather than empowered about their experiences. The stigma of mental health and addiction creates a negative outlook when it should be empowering people to educate themselves and others. According to the National Psychological Association, 87% of American adults find that mental illness is nothing to be ashamed of, and 86% believe that people with mental illness can get better. Empowerment-based interventions can benefit women in recovery from substance use disorders. Women face many challenges on the road to recovery due to limited resources for childcare, housing, and social support. Promoting recovery by identifying specific factors that empower women and providing knowledge of available resources aids the treatment and recovery process. The road to recovery is all about attitude. Displaying a shameful outlook can make things more difficult and backtrack the healing process. The components of recovery include hope, self-direction, individualized and person-centered recovery, empowerment, a holistic approach, a non-linear approach based on continual growth, building on people's strength, peer support, respect, and responsibility. The powerlessness people feel in addiction makes them focus solely on addiction and not on recovery. There are approximately 2.5 million people who misuse opioids, and only around 200,000 have access to addiction treatment. Feeling empowered to open up about opioid misuse leads to reduced opioid-related deaths. Reducing fatal outcomes of overdoses can be prevented through supervised drug consumption and take-home naloxone programs. Retention in opioid substitution treatment, overdose risk assessment, and overdose awareness can all aid in reducing the risk of overdose. Lastly, outreach and low-threshold services, enabling environment, empowerment of people struggling from addiction, and a public health approach can assist in reducing vulnerability. This knowledge empowers people to educate others on the recovery methods needed for addiction.